Dear viewers, now I will be talking about a topic, that is, you can look at the blackboard please. Shock. Shock spelling, please write it up, and also I will be very happy if you can take out a paper and write please shock, S-H-O-C-K, shock. Shock, all of you have used this word shock. While talking, you must have mentioned this word. I was shocked. ऐसे आपने वर्ड भी आपने यूज किया है. I was shocked मतलब का क्या है? मतलब यही है कि you were expecting something but you didn't get it. At that time you have used this word shock. Here also I will be talking about our physiological aspect related to shock. Please look at this diagram, what diagram I have drawn. Simple diagram I have drawn. In this diagram, I am showing two types of circulatory system. One is pulmonary circulatory system and another is systemic circulatory system. I will not remove this diagram. Slowly I will try my best to tell you the fact about the shock, different types of shock, causes of shock, and then what is happening in shock, what compensatory adjustment taking place during shock, and then how we will treat the patient who is appear in front of you with shock. Now here, this is the pulmonary, this is the, from this diagram I think इसमें कोई समझ में नहीं, आपको समझ में आना चाहिए कि मैं कौन सी डायग्राम ड्रॉ किया है. दिस इज राइट एट्रियम, दिस इज लेफ्ट एट्रियम. वी हैव 4 चेम्बर. आपको तो मालूम है, हमारे पास जो है चेम्बर जो है 4 चेम्बर होती है आपकी. एंड दिस इज राइट वेंट्रिकल एंड दिस इज लेफ्ट वेंट्रिकल. 4 चेम्बर्स आर देयर. तो if you have gone through my previous videos, I have told you the pressure present in the right atrium, that is the lowest pressure, that is the portion or that is the region where we have the lowest pressure. Lowest pressure hone nate, what is happening is the blood will move towards the right atrium, चाहे head से हो चाहे body से हो, through superior vena cava. Blood is moved from the head through superior vena cava, and also blood is moved from the body through inferior vena cava. Right atrium is filled, left atrium is filled, the blood is coming from the lungs. Now here this is pulmonary, this is pulmonary artery, this is pulmonary artery, and this is pulmonary vein. This is pulmonary vein. Now my intention actually is tell you the shock. Why I have drawn this diagram? Here I am showing the pulmonary circulatory system, also I am showing the systemic circulatory system. इसका काम क्या है? काम यही है कि systemic circulatory system का काम ही यही है कि this system is responsible to provide nutrition. This system is responsible to provide nutrient, oxygen, any type of nutrition, carbohydrate, protein, fat, everything is being provided by this system. Now the pressure which is present here, this is a closed circuit. आप समझ में आना चाहिए what is open circuit and what is closed circuit. In mammals we have the closed circuit. Because of this, what is the pressure here? The pressure here, in this pressure here is 120 millimeter mercury. This is aorta, and we have the receptors, that is aortic baroreceptors and carotid baroreceptors. What is the function of this? Just I am mentioning here. I am going to mention here some important aspect related to shock, which is again required to understand the mechanism behind shock. Now here the neuron which afferent, which will carry information about the pressure, and then here we have the 3 centers. we have the three centers. One is nucleus tractus solitarius. Here this is nucleus tractus solitarius. Here we have cardio inhibitory center, and then another center also we have, that is vasomotor center. That is vasomotor center. So three centers are there, and that is all these three centers we will have in the medulla. This is medulla, this is medulla, and this is pons. This is pons. Now, if you have followed my videos about the blood pressure regulation, where specifically I mentioned the role of three centers. So this is actually the nucleus tractus solitarius, or the sensory area, and this area is responsible to collect the information related to the blood pressure. Blood pressure क्या है, वो blood pressure कम हो गया है, क्या ज़्यादा हो गया है, that information is collected by the receptors present in the carotid body, and the aortic baroreceptors present in the aortic sinus. This is carotid sinus and this is aortic sinus. Here we have the receptor, that is aortic baroreceptor. Here we have receptor, the carotid baroreceptor, that is the pressure receptor. These pressure receptors are concerned with the change on pressure. Means these baroreceptors are responsible to identify the pressure change, alteration with the pressure. These are all high pressure receptors. And here also we have, once I have mentioned high pressure receptors, then I must mention here the receptors which is low pressure receptors. These are all cardiac receptors. Cardiac receptors. Again, if we talk about cardiac receptors, this is low pressure receptors, and this cardiac receptors is again divided into two: atrial receptors, atrial receptors, and then ventricular receptors. Ventricular receptors. Atrial receptors, it is type A and type B receptors. Type B receptors. Type A is concerned with the atrial contraction, and type B is actually is responsible on volume change in the atria. My topic is not to tell you about what are the receptors present here in details. Just I have mentioned here what are the different receptors we have. What are the receptors we have? Then coming to the shock. अगर हम इसको समझने के लिए कोशिश करें, मैंने ऑलरेडी बोल दिया है कि जब कोई चीज मिलता नहीं है तब हम सोच रहे थे कि शायद हमें मिलेगा, जब नहीं मिलेगा लेकिन नहीं मिला, तब we use this word shock. I was shocked, we were shocked. ये सेंटेंस हम अक्सर यूज करते रहते हैं. तो ये जो सर्कुलेटरी सिस्टम है, इसका काम क्या है? इसकी काम है, चाहे पल्मोनरी सर्कुलेटरी सिस्टम हो, चाहे सिस्टमिक सर्कुलेटरी सिस्टम हो, इसकी काम है इसके अंदर जो प्रेशर है वो प्रेशर को मेंटेन करना. उसके बाद व्हाइल मेंटेनिंग द प्रेशर, इसका और भी एक काम है जो है, दिस प्रोवाइड्स द न्यूट्रिशन टू ऑल टिश्यूज. नाउ इफ प्रेशर इज नॉर्मल, व्हाट इज द प्रेशर? हियर इफ वी टॉक अबाउट the pressure present here, it is 120 by 80. This is systolic pressure and this is diastolic pressure. So 120 by 80, that is the pressure. And now this pressure is there if blood volume remains normal. What is the blood volume? Normal blood volume, it is blood volume I am talking about. The blood volume is 5 liter. Normally, if person age becomes 70 kg and the age also in between 25 to 35, then normal blood volume, if we talk about, it becomes 5 liter. Along with blood volume, we must also talk about capacity. Capacity of the capacity of this circulatory system also is 5 liter. Normally, I am talking about the normal value. Blood volume is 5 liter. Capacity also is 5 liter. Now, in case there is something wrong, this wrong, look at this diagram. ये wrong कहाँ कहाँ हो सकती है? ये जो blood volume we are talking about, blood volume कम हो सकती है. Look at the heart. If there is anything problem with the heart, तो उसमें भी we can have an alternation with the volume as well as the capacity. Or suppose volume is normal, volume में कोई problem नहीं है, heart में कोई problem नहीं है, but ये जो आप blood vessel देख रहा है, ये blood vessel जो है इसकी एरिया जो है ज्यादा हो सकती है. और if there is any obstruction here, suppose obstruction is here, अगर ये obstruction है तो blood flow जो है, we are talking about systemic circulation, उसमें कम हो सकती है. तो looking at all these aspects, the shock is divided into 4 categories. One is first, write it up, hypovolemic shock. Hypovolemic shock. Then second is cardiogenic shock. Third is distributive shock. And fourth, that is obstructive shock. Again I will repeat. ये जो वॉल्यूम आई एम टॉकिंग अबाउट, ये वॉल्यूम कितना है? वॉल्यूम इज 5 लीटर और कैपेसिटी इज 5 लीटर. तो इसमें हाइपोवोलेमिक शॉक, अगर एनी केस इफ देयर इज एनीथिंग वेयर द ब्लड इज लॉस्ट, वॉल्यूम इज लॉस्ट, ब्लड इज लॉस्ट, सीवियर डिहाइड्रेशन, water is lost from the body, in that case instead of 5 liter we can have less than 5 liter, maybe 3 liter, maybe 2.5 liter, maybe 2 liter. So the volume can be lost, and that case we are talking about hypovolemic shock. उसके बाद वॉल्यूम नॉर्मल है, वॉल्यूम में कोई प्रॉब्लम नहीं है, कैपेसिटी भी सही है, लेकिन इसमें जो हार्ट आप देख रहे हैं, इस हार्ट में क्या है? इसमें वी हैव द cardiac muscle में this cardiac muscle is there, this heart is made up by the cardiac muscle. In atria this is called atrial muscle. ये जो ventricle आप देख रहे हैं इसको कहते हैं ventricular muscle. अगर blood supply यहाँ पे कम है, any case the blood supply यहाँ पे कम है, cardiac muscle coronary circulation में problem है, blood supply in the muscle is less than normal, or is there any valvular defect, so in that case heart will not be able to pump adequate amount of blood, stroke volume is less than normal. So in that case also the systemic circulatory system or the pulmonary circulatory system will not be able to deliver adequate amount of nutrition, adequate amount of oxygen. So that case also we call it कार्डियोजेनिक शॉक. मीन्स देयर इज प्रॉब्लम विद द हार्ट. सब कुछ ठीक है लेकिन प्रॉब्लम विद द हार्ट, इसीलिए उसको कह रहे हैं कार्डियोजेनिक शॉक. इसमें फिर से रिपीट कर रहा हूं, वॉल्यूम में अगर प्रॉब्लम है, हार्ट ठीक है, सब ठीक है, लेकिन वॉल्यूम में प्रॉब्लम है, वॉल्यूम कोई भी कारण से वॉल्यूम कम हो चुकी है, तो उसको कह रहे हैं हाइपोवोलेमिक शॉक. उसके बाद थर्ड जो है इट इज डिस्ट्रीब्यूटिव शॉक. मीन्स हार्ट नॉर्मल है, वॉल्यूम नॉर्मल है, लेकिन ये जो कैपेसिटी है इंस्टेड ऑफ 5 लीटर this may be 15 liter or this may be 20 liter. Means there is problem with the distribution. There is a vasodilatation, severe vasodilatation. ये जो vasodilatation सीवियर वैसोडायलेटेशन होती है, तो उस केस में देयर इज एन इंक्रीज इन द कैपेसिटी ऑफ द ब्लड। जो कैपेसिटी की हम बात कर रहे हैं, नॉर्मली दिस बिकम्स 5 लीटर, अगर उस कैपेसिटी हम बढ़ा देते हैं बिकॉज ऑफ वैसोडायलेटेशन, तो प्रेशर कैन बी रिड्यूस्ड ऑल्सो, then adequate amount of nutrition we may not be able to deliver. In that case we call it distributive shock. There is a problem with the distribution. मान लीजिए हार्ट को ठीक मिल रहा है, लिवर को नहीं मिल रहा है, मान लो लिवर को ठीक मिल रहा है, किडनी को ठीक नहीं मिल रहा है, मान लो किडनी को ठीक मिल रहा है लेकिन जीआईटी को नहीं मिल रहा है, तो इन दैट केस there is a problem with the distribution. There is a vasodilatation or vasoconstriction, कुछ भी हो, there is a problem with the distribution, that is called distributive shock. Another is, last is, if there is any obstruction, यहाँ पे obstruction है और यहाँ पे obstruction है, pulmonary embolism, there is a problem with the circulatory system present in the lungs. Because of the obstruction in the pulmonary artery, the blood will not be able to flow properly in the lungs. So lungs tissue will not get proper nutrition, proper oxygen. So in that case also the tissue can be in a shock condition, body will be in a shock condition. So that condition is called obstructive shock. Now my next video I will request all of you to watch hypovolemic shock. I will be talking about cardiogenic shock, distributive shock, obstructive shock. Separately I will be talking about what are the causes of hypovolemic shock, how then what compensatory adjustment takes place during all these shock, and then how we can treat the patient. Again, if you please remember, in all this shock there is a compensatory adjustment. If compensatory adjustment fails, then the shock is irreversible, not reversible, irreversible. If it is there, compensatory adjustment is there. Again, please remember, if compensatory adjustment is there, then it is reversible shock. But it is not there, then it is irreversible shock. Thank you.